Hi guys, welcome back to my channel. My name is Ariana and I am a pregnant type 1 diabetic who's sharing all about my pregnancy journey on YouTube and on Instagram. Be sure to follow along on Instagram where I give weekly updates on how everything is going. Now that I'm in my third trimester, I wanted to share all about how my second trimester was, what changes I saw in my diabetes management, how I managed my diabetes during that time, if I incorporated exercise into my routine, all my symptoms, and all that jazz. If you did miss my first video, I talked all about my first trimester here, and you can also read about it in my blog post linked below, where I talk about preparing for pregnancy with type 1 diabetes, how we found out, and how I managed my diabetes in my first trimester. Okay, without further ado, let's talk about my second trimester. It was fine. As mentioned in my video before, I had a lot of lows my first trimester. I kept an A1C of 5.4, which, if you know me, that's the lowest I've ever had my A1C ever since diagnosis at age 10. So that was pretty amazing to me. I truly did not think that in the second trimester it would be as low, just because as my insulin resistance has gone up, I felt like it was a little more difficult to manage my diabetes this trimester. It was 5.4 again for this trimester as well, which I am so thankful for. I like truly can't wrap my mind around the fact that my blood sugars have been manageable this pregnancy. They definitely haven't been great at all times, but I am trying my hardest, and it just feels good to like see that number and knowing that I'm, doing a good thing for my baby. My time in range for my Dexcom data ranged from 75 to 92% in range for my second trimester. That is staying between 60 and 140 mg/dl blood sugar wise, which is recommended for pregnancy. Very happy with that. The doctor wants me at least above 70% of my time in range, so having 75 to 92 is awesome. My biggest contributor to feeling like I am having my blood sugars under control slightly, I mean for the most part this trimester, has been pre-bolusing. I take insulin anywhere from 30 to 45 minutes before I eat now because of my insulin resistance and not wanting to spike after I eat, basically. I basically do the same thing every morning. I have the same breakfast every morning. That's been really helping my routine. Same with lunches. Weekends are a little like, I'll go out to a restaurant, I'll have a dessert. Things will be a little more wonky, but as long as I am pre-bolusing, it just kind of like helps me get ahead of things because insulin takes that long for it to work in my body. Another thing that I have kept up with since my first trimester has been having a protein with every carbohydrate that I have, basically. So if I have 15 grams carbohydrates, I'll have 7 grams protein. That has helped not send me skyrocketing and helped me kind of like even out after eating. We went on our baby moon this trimester. We went to Nantucket and it was amazing. We actually did a little mini moon after our wedding to Nantucket a couple years ago, so it was really nice to go back. We stayed at the Wowinett. We went bike riding, we went shopping, we ate food, and it was delicious and it was exactly what I needed. However, I all of a sudden started to get some major insulin resistance halfway through the trip, where I was taking insulin, and my sugars were not coming down, and it was really frustrating, especially because I'm like, okay, this is our last trip to enjoy just the two of us before the baby gets here and before like I can't travel anymore. And I really wanted to enjoy it, but there were just some parts that were really frustrating because of my blood sugars. And if I wasn't pregnant, maybe I wouldn't have held such importance on what my blood sugars are, but obviously like they affect someone else right now. So I had a lot more guilt and a lot more worry than I normally would on like a whatever vacation where I'm just trying to enjoy myself. Luckily, anytime that I've seen insulin resistance and I maybe don't have a doctor's appointment that week, I will just email my high-risk doctor. She's a fellow type 1, so it's been so nice to have her eye on things. Also this trimester, so I am currently on the Omnipod 5. I was doing automated mode with, I think it was around week 25 I switched to manual mode at night because I was waking up closer to 1:30 and the doctor wanted me to have more of a fasting blood sugar of around 80, 75 or 80. So we switched me to manual mode overnight and I've been consistently waking up a lot lower, which has also helped my time in range. We haven't moved to manual mode full time because my numbers are still working for me during the day. Another diabetes thing that has affected me this trimester, hello Maisie, has been my high blood sugars have been very sticky. So if I'm high, I can take a correction, for that number, it's not gonna do anything. I have to like take 3 times, 4 times as much insulin just to bring something down into range, which is a little frustrating, but we're working with it. Second trimester symptoms that have been really great to feel. By week 19, I started feeling pretty consistent kicks. I have an anterior placenta, which technically makes it a little more difficult to feel kicks. I'm feeling them. He can kick. I've also definitely, like the moment we came home from our baby moon, which was I think week 23 or 24, I started feeling like the exhaustion of third trimester come on. I've been pretty good this whole second trimester. Exhaustion wise, it felt nothing like my first trimester, but toward the end of my second, I am like, I can get 1 major task done a day before I am checked out and horizontal on the couch. I have definitely been exercising this whole time, which I'm very, very thankful for. It's obviously gotten a little harder, but I'm still doing my strength classes and my Pilates classes 3 to 4 times a week. I would say I was doing it. More adjustments, obviously. I had the wedge in my Pilates classes so that I'm not flat on my back for a long time. Feeling good about that. I really want to keep it up, obviously, through the third trimester, but it's getting a little tiring and I'm big and I'm in pain. We'll get to that in my third video. I asked on my Instagram a little bit ago for any questions that you wanted to know about my second trimester, whether it be diabetes wise or kind of really anything. So let's dive into some of those. What are your go-to low carb meals and snacks to maintain good blood sugars? I'm not eating low carb. I am, as I mentioned, pre-bolusing is my secret strategy, but I'm really not going low carb. I have about 35 grams of carbohydrates for breakfast, 30 to 45 grams of carbs for lunch. But afternoon snacks is where my cravings hit, and I'll have like some crackers, but I'll always have like cheese or like a protein, some sort of protein along with it. So I'll do like one of those little Baby Bell cheeses, or I'll do a Chomps bar, or I'll do some cottage cheese. And then I will pair it with whatever I'm craving, which right now is pretzel goldfish. Favorite spots for Dexcom and Omnipod with the growing bump. So I have never been a fan of stomach sites. I don't know what it is. Stomach sites have always creeped me out and they've always hurt a little bit. So what I've been doing is I have my Omnipod on my arm now. I rotate arm, top of thigh, and hip and like upper butt. Those are my sweet spots. I've done only those my whole pregnancy basically. In my first trimester, I noticed a lot of my sites were bleeding a lot. It's because we have extra blood volume while pregnant. Been a lot better actually in second trimester and third. So right now I have my Dexcom on my thigh. In that meantime, I'll rotate the Omnipod for my arm and then my butt and my hip and kind of just like keep that rotation until I switch sides. Have your lows been less frequent in my second trimester? Yes. The only time I am really low is if my basal rate is a little too much during the evening when I've been doing manual mode, or if I take too much insulin or I pre-bolus and wait a little too long. But my lows feel a lot less consistent than they were in the first trimester. What were some early signs of insulin resistance? How did you notice it? Honestly, it just felt like my sugars were hanging out a little too high. I would correct with normal ratios and they would not come down. It started getting really frustrating when we were on our baby moon was when I started seeing some increased insulin resistance. I saw it like a little bit sporadically before then. Yeah, it just looks like continuous high blood sugar that isn't coming down when you're like giving all the insulin that you should be giving. When did you start changing to maternity clothes? Pretty early on. I think like toward, I want to say like the beginning of my second trimester. I have an anterior placenta, which I think you show a little earlier. I felt like I was showing so early. I'm also really weird about things being tight on my belly. So I got away with wearing my regular leggings, my regular exercise leggings for a bit longer. And I had some, when it switched from legging season to bike short season. My biggest thing though, and why I like the maternity shorts, okay, so I changed and this is what I'm wearing now. So these are a pair of maternity shorts that I got. I got like 5 pairs of these shorts. I'll link them below. I have them in every color. They have pockets. I got them on Amazon. They feel like they're Lululemon. I'm in. It goes up to here, which seems like a lot, but all of my tops were crop tops. I was such a crop top girl. And now I can't be a crop top girl if I'm wearing low rise everything. These maternity bike shorts and leggings and stuff they make it easier. I can wear the same, this top is not maternity. It was just like a regular top. It just works so I don't have to show my belly off as much. I really thought maybe I would be a belly showing girl. I'm not. Have they given you or spoke about an induction date yet? Yes. As of right now, we are planning on inducing around 38 weeks. It really depends on his size. Starting in a few weeks, I will be going in for high-risk appointments twice a week. So that just helps them monitor that everything is okay. Yeah, right now it's 38 weeks. I think it really just depends on where he is size-wise. How to meet healthcare providers' expectation of 100% perfection against living your life when it comes to mocktails, treats, etc. This is a great question. You should ask your healthcare provider if they're 100% perfect in everything that they do, because I guarantee you the answer would be no. If your healthcare provider actually has experience living with type 1 diabetes, it is amazing. My high-risk doctor right now is a type 1 diabetic and who's had 2 healthy babies in the past. That alone makes me feel so seen by her. You guys know, if you've seen all of my mocktails on Instagram, all that jazz, I am a big proponent of treat yourself and keep your life in balance. As long as you care about your body and you care about your health, there is no reason why you should not enjoy it. It's impossible to meet 100% perfection, and it's unhealthy mentally. Okay, how to lower fasting blood sugar. So I just had to do this. This is why I went on manual mode at night, because in auto mode on the Omnipod, it will not allow you to get a lower fasting blood sugar than the 110 range. And we needed me around 70, 80. So we pulled me off auto mode at night, put me on manual, we adjusted my basal rates, and I still have a couple lows in the middle of the night. We actually just changed my settings today, so I'm hoping that fixes things. But that has lowered my fasting blood sugar, basically allowing my basal rates to just do their thing overnight. I wake up around 70, 80, which my doctor's really happy with. Reacting to high blood sugar numbers, how to stay calm when numbers are bad. Boy, did I deal with this in the beginning of my second trimester. A lot of you guys followed me when we went up to Big Bear for a weekend, and I was just having like hours and hours of feeling like I made every wrong decision I could have possibly made that day. And all it did was stress me out more because it affects somebody else right now. What helped me out so much was you guys. Having so many people let me know. I know it feels really bad now. I know you feel really guilty about this right now, but just know that the fact that you are trying your best is gonna be more than helpful to your baby than you already know. That was so helpful to just understand that one set of blood sugars in my full week, of calculation of time and range isn't going to impact my baby as much as I really felt like it would. This is a long process, and as long as you are taking care of yourself to the best of your ability and doing your best, your numbers will not be 100% perfect. It's just so unlikely. And it's exhausting and it's hard, and you still matter even though you are carrying a baby inside you. Your mental health still matters, and your stress, still matters because it also affects the baby. And take a deep breath, when you see your numbers are high and you're not being able to fix it, try not to rage bolus, try to get outside, go for a walk. Mocktails, this is how I navigate them. This doesn't always work. Sometimes it fails terribly, but Here's how I do it. So right when I sit down at the restaurant, I will look at their non-alcoholic menu and I'll pick one that obviously sounds best to me. If it sounds really sugary, I will always ask for them to like cut it with sparkling water or just make it with a little less sugar. Right when I order it, I will take about 15 grams carbohydrates bolus. That way they're making it, even if they take up to a half hour to give me my drink, like I have insulin that's coming my way. Normally we'll also get an appetizer too, so that kind of helps with that. The moment we get the appetizer, even if I don't have my mocktail yet, I'm taking more insulin. And then obviously, like, most mocktails are just juice. I'm not gonna have more than one of those, you know, at a restaurant. That just doesn't tickle my fancy, unless it's really good, because I've had some really good ones, especially on our baby moon. 9 times out of 10, the 15 grams, I could take a little more if I wanted to, but that'll do it for me. I'm already taking more insulin for appetizers, for the meal. It's all getting calculated in there. That's how I've navigated it. It's even easier when they're like, what kind of drink do you want? And then I'll say, I want something spicy, low sugar, non-alcoholic. And that's normally great because then they'll do like sparkling water with like jalapeno and infusion of something, and that's like, love it. I think that's all I have to share about my second trimester. I understand why people say that second trimester is the best trimester, because I had my energy back, I was feeling like myself, I got to travel. Well, if you have any more questions, please drop them in the comments below, or feel free to reach out to me on Instagram at Ariana Frere. Give this video a thumbs up if you liked it or found it helpful, and please subscribe to my channel if you want more type 1 diabetes stuff, baby you know, motherhood, all that jazz. We're entering a new era over here and I am excited. I have a lot more type 1 diabetes stuff on my blog, cupofoj.com, and I also do make fun merch for those living with type 1 diabetes at shopcupofoj.com. So thank you for watching. I will talk to you soon. One more trimester and we're having a baby. Bye.